care. Republican Congressman from Virginia, Eric Cantor, is joining us now. He's also the House Minority Whip. Congressman, thanks for being with us.
Good morning.
First and foremost, I want to ask you about what happened in Massachusetts. It seems so significant to me and many others that this is a state, especially since it was the late Ted Kennedy's seat, that's almost synonymous with the health care reform movement that Democrats had. And the voters did speak loud and clear, and now Scott Brown will go to Washington, and we know his position on health care. But when Nancy Pelosi, the Speaker, also comes out and says the votes just aren't there, what is the next step for the Democrats?
Well, Jamie, first of all, it seems that the vote in Massachusetts reflects somewhat of a deep anger on the part of the people of that state. And frankly, it was repeated after the elections in New Jersey and Virginia a few months ago. And the people, I think, have stood up and said, look, we're tired of the arrogance of Washington. Please start listening to us. And that's the problem when you look at the health care bill that Speaker Pelosi is trying to jam through the House. It does not reflect what most Americans want out of their health care. We've got to work to bring down cost, and that's really where the debate has got to start. And I'm hopeful that the administration, the president, will work with Congress in a bipartisan fashion so we can actually get some reform done. But the way they're going about it is not what the American people want.
Well, let me ask you about that, because Republicans have said, yourself included, that the ideas that you have for health care reform would bring down cost. So what would you tell Democrats, given the opportunity to sit at the table? What changes would you make to the current bills, both in the House and the Senate, that could bring enough bipartisan support to get it passed?
Well, first, we have to realize that the American people don't want a government takeover of their health care. So once we pass that realization, and everybody hopefully could then sit down at the table, there's a lot we can work on together. In fact, I have met with Leader Hoyer on the other side of the aisle and presented him with our Republican plan. Our Republican plan deals with the issue of cost. How do we introduce real competition, give folks a choice of their health care plans, and maintain the quality we have without the prospect of government replacing the system that people know and enjoy in terms of quality.
So
those are the kinds of things deal with.
It wouldn't be a replacement in its entirety of a government plan, but there are some parts of the current plan that you feel could be incorporated with the addition of the ideas that the GOP and Republicans have.
No, I'm saying we have got to start over. This plan that the people essentially spoke out on last Tuesday in Massachusetts, I hope is dead now. And looking forward, I think we can affect positive health care reform. Republicans have been out there with ideas such as purchasing insurance across state lines, such as instituting litigation reform to get the unnecessary frivolous lawsuits out of the examining room, such as promoting choice in health care coverage so that people can have the kind of insurance that they want, not what Washington tells them.
That's a very different answer, so I'm glad that you specified and let us know about that. So what's the timeline? The campaigning will soon begin for the midterm elections, and as you look forward, and others do as well, can health care reform or this overhaul that we know that the president wants be accomplished in time for people to go back to their constituents and say, here's what we got you, and give them something that they can support?
Jamie, the way forward is for Speaker Pelosi to come out and say we can't pass the monstrosity that the House passed prior or the Senate. And we've got to start over, and we've got to look at ways that we can affect reform and lower costs. But what we've seen all week long is that the Democrats have not done anything but talk to themselves. They seem to be focused on the bills that they passed and trying to tweak them to see what they can do to cut even more deals to jam this bill through and, frankly, down the throats of the American people. We've got to start over, and we can affect positive reform, but they can't go about doing it given that this president promised to change the way that Washington works to get it done, and he hasn't done that.
Congressman Cantor, thank you very much for being with us. Nice to see you.
Thank you.